Hello, it's Dr. Rhonda Johnson. Today is Monday, March 27th, 2023. Today I'm talking about children born during the pandemic. Well, in December, the CDC published an article on their website that showed that more than 90% of children between the ages of 6 months to 17 years have antibodies from either infection or vaccination against SARS-CoV-2. This data came from testing blood samples from commercial lab data across the United States. Now, there was an article published in the Atlantic magazine recently that talked about the situation of babies and children growing up in this SARS-CoV-2 infected world. Now, the Atlantic article talks about what this will mean to babies and children born since 2020, because after all, they are going to coexist with this virus from birth to possibly death. So what do we know as of today about the virus for generation Coronials? Now, the Atlantic doesn't call it that. Some social scientists are calling this generation Coronials. That's the babies and children that are born during the COVID-19 pandemic. Well, what do we know? Well, data is mostly from the CDC, what I'm sharing, for American children. We know that children can get long COVID. We know that children are far less likely to experience serious complications from COVID than adults. We know that children can get MIS-C, which is that multi-system inflammatory syndrome in children, which is a life-threatening complication after COVID infection. But good news is that MIS-C, according to the CDC, has declined since the start of the pandemic. We also know that children have died from COVID. Since the start of the pandemic, more than 2,000 American children under the age of 18. I know that's a small number compared to the 1.1 million number, but it's still not good. And it's enough to make COVID-19 a leading cause of death for U.S. children. There was an article in JAMA Network in January 23, the Journal of the American Medical Association, that showed COVID-19 ranked 8th among all causes of death among children and young people between the ages of 0 to 19 years of age, and the first in deaths caused by infectious and respiratory diseases in the United States. Now, the Atlantic article addresses the fact that babies and children born in this pandemic will likely have more total number of exposures to SARS-CoV-2 in their lifetime, meaning they will have repeated infections. What will this do over time? That we don't have answers to. We don't know. Now, we know that children's immune systems operate somewhat differently than adults in the first decade of life. And one expert who was quoted in that Atlantic article suggested that getting the virus in childhood may actually be better in the long run because children may then respond better to future infections. But we don't know that yet for sure. So what can a parent do to help protect their children from a virus that's hard to avoid? Well, they can continue mitigation strategies such as ventilation, air cleaning, masking, and vaccine to help mitigate this disease for generation Coronials. That's my message today. Please feel free to leave your comment. And thank you for listening.